The Vancouver Island Health Authority is under fire tonight for doing something that it would normally be praised for. VIHA says it's planning to reduce wait times for MRIs. They're planning to do that this year, but critics say the plan to give patients quicker access to the diagnostic test will waste resources and ultimately cost taxpayers more money. A-News reporter Shachi Kurl has the details.
The bad news, wait times for MRIs on Vancouver Island are getting longer. The good news, the Vancouver Island Health Authority wants to fix the situation. So why is the NDP calling that bad news? It has to do with how VIHA plans to add more diagnostic scans. The health authority is asking for private contractors to step forward with bids.
Wait times for MRIs have gone up, and right now they're over a year for routine non-emergency scans, and that's something we would like to reduce so we can improve patient access.
VIHA's put out a request for proposals for private MRI firms to perform an extra 3,000 MRIs in the next 6 months at the lowest possible price. But New Democrat health critic Adrian Dick says no matter how low the bottom line, that could still end up costing taxpayers more.
We know that the health authorities get funded around $150 to $200 per MRI. We know that if you go to a private MRI service in Victoria, it costs $750, so everyone can do the math.
The NDP says a scenario where VIHA looks to outsource while machines already paid for sitting in hospitals in Victoria and Nanaimo sit idle and gather dust is outrageous.
They're not using these MRIs that people fundraise for. We use our MRI machines in the public system less than other provinces. We are less efficient in that regard, and we do fewer MRIs and have longer wait times than any other province in Canada.
Based on past numbers, VIHA is able to do more. Last year, it completed just over 22,000 MRIs. This year, a drop in funding is holding VIHA to about 18,000 scans. So why ask others to do a job VIHA can handle itself?
Residents from North Vancouver Island have to travel to either Nanaimo or Victoria to get an MRI scan. And there is a provider in the valley, in the Comox Valley, that we hopeful might submit a proposal which might increase and improve access.
Still wary it's going to take flack for its money argument. The Vancouver Island Health Authority is quick to point out nothing's been settled. No contracts have been awarded yet.
Shachi joins us now with more. Shachi, has VIHA decided not to use their own machines at all?
Eric, if you read that request for proposals that VIHA has put out, it certainly seems that way, but the health authority is saying it's also developing its own so-called shadow bids to compete against those private firms, and it's trying to determine if doing the job in-house with hospital machines that taxpayers have already paid for would be more competitive than paying private operators. So at worst, this is or will be outsourcing. At best, it's a taxpayer-funded exercise in figuring out how efficient or inefficient VIHA is at doing MRIs itself.
Shachi Kurl reporting. Thank you, Shachi.
You're welcome.